Good evening, everyone. Welcome to tonight's Scrutiny Health and Social Care Review Group meeting. Just the one item this evening. We could just go through the admin stuff to start off with. This meeting is being live streamed to the public, and a recording will be available on the council's website 24 hours after the meeting. You're required to wear face masks on entry and when leaving the room and when moving about. Hopefully you've all scanned the COVID app, the NHS COVID app on the way in. If not, do it on the way out. Can you switch your microphones on when speaking and make sure that you switch them off when finished and speak directly into the microphone. If officers joining the meeting using Teams, use the hands up icon on your screen for questions and comments, and please turn your cameras and microphones on. If someone who is on Team, joining us through Teams, if they can indicate that they can hear what's going on. Okay, thank you. Okay. Apologies for absence.
Yes, Chair, apologies from Councillor Ackley.
Thank you. No minutes this time. Disclosures of interest.
None that I'm aware of, Chair.
Urgent business.
Again, none, Chair.
References from committees or
none, Chair.
Okay. Chair's update. I have nothing to report on since the last meeting. Brings us on to the Contained Outbreak Management Framework. Laura.
Thank you, Chair. I will be supported on this by Elizabeth Elliott, who we can see on screen. So I'll wave at Elizabeth and hopefully she'll wave back. Elizabeth is one of our registrars supporting us on our public health work. So you'll remember that I came to speak to you about the Contained Outbreak Management Fund as an urgent item back, I think in April or May, before we put it to executive. And I said at that point that this fund, our allocations of funding may change over time. And that I would come back and talk to you in a bit more detail. So what's happening is that I am proposing to take the plan that I'm going to talk to you about to executive for sign off, but also talk to you about the flexibility that we may need to have and the development of a pipeline of projects that if one of the other lines on our programme we don't need anymore, we can bring money in to do different things. So I'd like a discussion with you about some of the things that you might like to see put on the pipeline. So I'd like to get your support for what I'm putting forward, but also if you have any ideas for a pipeline of projects. And Elizabeth has a bit more of the detail if there are any particular questions. So I'm happy if you, when we're on a page, because there's a lot of detail in this presentation, if you want to ask questions. So I'll pause on each page when we get into the detail, and then also pause at the end when we've got a bit more of some of the ideas that we're working on. Does that make sense? Okay. So just to remind you, this is the split of funding that I came to you with earlier in the year. And I talked to you, and actually I think it was Lucy presented, that we have this money to help us to support our response on COVID. And we were allocated it last financial year. We have to spend it by the 31st of March. And we need to keep enough in there that if something happens in the winter, we've got funding for our response funds. And you can see on the bottom line on this page, we've reserved 1.1 million for response activity to keep a reserve there. So since I came to speak to you last time, we've now received some guidance from the government on what we can spend this funding on. And we contain Outbreak Management Fund. We call it COMP for short. We think that the government has also refreshed its data, and we were expecting that they want us to produce a new management plan for the autumn. They've now said that they don't want that, so that's helpful. We do know, though, that MHCLG, who is the main government department that we get our funding from, wants to keep a good eye on how we're spending this money. And we are having to do quite detailed returns every quarter about what we're doing to spend it and our plans for spending it by March 22. The other area that's changed is if the government decides it will fund lateral flow testing past September, that will free up some more money and we will be able to do some different things. And we also think it's important that we use some of the comp funding to actually respond to the Talk, Listen, Change research project that the public health team and the University of Bedfordshire have been undertaking, going out, talking to the communities have been impacted. So I've just given you a flash up there of some of the things that we or suggested that we use the comp funding for. They're quite broad and we can interpret them, but you'll see as we move through the programme and what we are planning to do, that we are thinking about all of these areas, but also allowing ourselves a bit of flexibility to be able to keep some reserve back. So I'm now going to move on to some of the detail, and these are the slides. If you want to ask any questions, just stop me while I'm doing the process, while I'm talking, because you'll probably need some of the detail on the slide. So this page gives you some of the things that we're doing to help manage the outbreak when we get outbreaks. So we've got additional resources going on public health consultant capacity, and significant amount of resources going into how we support schools. We've now got some updated guidance on what's expected of schools in September, so we're refreshing how that operates, and also the advice and support that we've been giving to businesses. We've currently got some regulations in place about how we what businesses have to do, and that allows the Director of Public Health to take action if necessary. We have used some of our comp funding to support additional environmental health officers going out to provide advice to businesses, which has been very welcomed, and we want to continue for the rest of the year. You'll know, and you'll have seen some of the reports that Lucy and Sally have given you as the Director of Public Health around all of the intelligence and data that we're using to manage the COVID outbreak and situation in Luton. So we've had quite a lot of additional work going on, and we'd actually like to appoint an epidemiological specialist to come in to really focus on what's happened in Luton and think about what we need to do. We have been identified as an area of enduring transmission, and what that means is that our rates go up and down, but we don't go down as significantly in other areas, and maybe Elizabeth can talk to you a bit more about that. But it's something that is identified particularly in areas with deprivation, and it's not just us, it's other areas, but we need to understand that in a bit more detail, and we need some specialist support. We've been doing a massive amount of work around comms, communications and engagement as part of our COVID response. And we've used comp funding to fund a specialist post in the comms team. We want to do more of that work, and actually we've just commissioned some additional work to focus around vaccination for young people and come up with some resources that will be targeted at young people. And that's not going on Facebook or on Twitter. That's looking at different ways of talking to young people. I was going to sound old then because I don't actually know what they are, but and some different ways of targeting young people. And you'll know that we've also been doing local contact tracing. So we've been taking cases within 24 hours of them being notified to the national team, and the success rate of the local contact tracing is above 90%. They do really fantastic work. So we want to continue some of that work as well. So any questions on that page?
Yes, so there's the first three of these items it mentions, uses the word additional. So the figures in the right-hand column, is that on top of the money that was allocated in the original plan, or is that including that?
That's including the money that was in the additional plan. The use of the word additional there is because they are not part of where they're staff, they're not part of our normal establishment. So this section is that we've just varied the figures slightly.
Councillor Moore?
Yeah, just looking at the contract tracing thing, I appreciate that money's gone down, which is understandable given the changes to the national regulations. But obviously the national regulations have now gone down to such a level where basically people are not needing to self-isolate unless they themselves have symptoms. So I'm just trying to get my head around what benefits there are to the local contract tracing under those national restriction rules.
It's still a very important role to do for that local contract tracing for the cases that we have. This may be an area that we want to vary what this team does. We're thinking at the moment of whether, if we see a real drop-off, we start to use this team to do some work on encouraging people to take up vaccination. So this is one of the, well, thanks for highlighting that actually. This is one of the ones where we might change what we're doing with that team, and we might keep them but get them to do some other things, because they're really good at doing that follow-up calls with scripts to really engage with people. So that's been very positive.
Yeah, thanks very much.
Laura, can you give us some indication of where we might be at Christmas? Somebody must have done some projections of some sort.
I can't, I'm afraid, but I can ask the team to start thinking about what the numbers might look like, but there will be various scenarios around. So perhaps when Sally gives you her next COVID update, I'll ask her if she can think about what the forecasting might look like. The forecasting has been quite difficult. Because
we know from the previous year that it goes up during the winter.
But what we don't know at the moment is the impact of vaccination, but that's quite a public health specialist question. So Elizabeth, did you want to come in there?
Hi there. I mean, I'm just going to really follow on from what Laura said, which is there are obviously going, so many uncertainties. We know that vaccination, we have certain groups within Luton where vaccination rates are lower. So, we can absolutely look at it. I'm not an epidemiologist by background, but, we absolutely can look at the implications, but there's, a number of unknowns. So I think it's absolutely something we can look at, but I can't give you any answers now. But absolutely, there are definitely nationally there is the view that numbers will be going up over the winter because of respiratory infections, or always do. But yes, sorry, I can't be more specific.
And that is actually one of the reasons we would like to have an epidemiological specialist ourselves. We are spending government money through contained outbreak management. Yeah.
Nikki, you have your hand up.
Yes, I'm just in very much in support of Elizabeth and what Laura's saying. So I'm just looking at the vaccination rates here for Luton, and for the younger people, we are still at about 50-ish%. for those age 18 to up to 40. So on that point that I think Laura's mentioned about this enduring transmission, until we get that vaccination and we get the confidence of the local population, and I think that's really what I would say as being a partner in this on the contact tracing. It really is using every contact, making every contact count, as they say, and very often it is having that personal conversation with individuals and communities where you can do the myth busting and you can build the assurance. So all I would be emphasizing is that we would be absolutely malleable and flexible to work within this, because remembering that the likelihood is that we're going to have a booster program that starts next month in September. So we're already behind the curve. And I, from my perspective, we'll never get ahead of the curve until we get that confidence of more of the immunisations and the double dosing of the adults.
Thank you.
Do you know, with the young people, there needs to be more comms about fertility. I know lots of young people are worried about fertility. They're youngsters, they're thinking in the future they'll have a family, and there's so much on social media that's negative. There needs to be more out there about that, And I know there are some videos around because they have been shared with me.
I think that's a key line that the CCG are working on to get some of those messages out. We saw a suggestion, I think it was in Hertfordshire, of a specialist session so that people could talk to doctors about any concerns, and that is a big area. That's a big area of work. So, Nikki, did you want to say anything more about that?
No, absolutely, and just picking up that point, it is working within the Maternity Liaison, and we're working hand in glove with all the midwives, obstetric units and family planning clinic, all of that element, because you're absolutely right. I think there's been a fair bit of work done in this area, but it just needs to be repeated. It needs to be a cycle of ongoing. And what I think we've identified is it needs that personalised touch where individuals can have the conversation on a one-to-one. Hence, we've got to make that really system-wide, so it almost becomes business as usual in the maternity, in the maternity departments.
Just one more question. I think the last meeting you mentioned communications with the universities. Is that part of the plan for the communication with?
Yeah, absolutely. From our perspective, it is that we're working completely with the local authorities, comms and team. But yes, it is 100%. We really thanked you last time for that link back into the university. So that's key work for us now.
Okay, thank you.
So you'll see here that we are continuing to show, this is slightly reduced on what we said last time, but continuing to show spend funding on a lateral flow testing program out in the community. You will have seen we've changed the model in that the fixed site is the bus in St George's Square, but we've now got big programs of community outreach for people to collect tests and also undertake a supervised test if they want to. We are waiting further government guidance on how this program will roll out. It may be that the government does what it did to us when I spoke to you about Conf earlier in the year. We thought we would be funding that ourselves for July, August, September, and the government stepped in and funded it. If the government comes in and says it will fund LFTs, that would give us some more comp funding to spend on other things. Does that make sense? Because it's kind of thinking about what might happen. So that there might be a bit more, that might give us some more money to do other things. We have included quite a lot more work about behavioural insights intervention. So that's really about how we can encourage people to change their behaviour. You will have seen public health talk about this before on some of the nudge theory, where if you if you put footsteps on and make walking up the stairs a bit more fun, people might do some of that. So we're thinking about how you use behavioural insights and intervention about vaccination in particular. And you can see that there's some spend around this, and also for us, so to have some more comms on behavioural intervention, and also to have a specialist post. So where we've used behavioural interventions at the moment, we've piloted some of the people saying that they didn't want to go for vaccination because they couldn't get there. So we're piloting whether the Vaxi Taxi, which I hope you've seen the publicity for, on taking people to the fixed vaccination sites really work. So this is quite a big programme of work in here. And we're using this to just test out some ideas and different ways of working. So if there are good ideas coming from other places, I'd like to say the Vaxi Taxi was original, but I think we've borrowed that from, can't remember where it was, but it was somewhere further up north. We would also like to support the work that the CCG are doing on vaccination. And they are running the programme and putting in some extra resource. So you'll see a vaccination project manager linked to the CCG, because over the next period, we will have vaccination for those people who haven't been vaccinated yet or need their second dose, at the same time as we're looking at running a booster campaign and a booster campaign for flu. So actually, we think that we need a bit more resource in there, and that will mean that we can be more proactive working with the CCG when we come up with innovative ideas. So that programme there is all around behavioural insight. We are also continuing with the COVID marshals really until the end of September at the moment, when we know that the reopening will fully happen. And what they're doing at the moment is going out talking to businesses. So they've been reinforcing some of the messages. So they've been an important resource for us. So any questions on that bit? No Vaxi Taxis are using our Hackney trade. So if you go and look at the Hackney stand outside the town hall, you'll see some of the Hackney cabs are logoed up as Vaxi Taxis. So yes, we could do with more people. There are lots of opportunities. So if you've got people who find it difficult to get to the vaccination centres or to pharmacies, which is where vaccinations are taking place now, they can phone up. It's free. You can use the Vaxi Taxi. It's also a good way of supporting the Hackney businesses, which have been severely impacted by COVID, because people aren't going out and about quite as much.
Are we getting preferential rates?
We're getting the fees that have been negotiated with them. So if you wanted to go to get your vaccination, you can phone up. It's free. They wait and then bring you back.
Talking about the work with the CCG, what sort of things are the council doing with the CCG?
So the CCG, we've been supporting them on the getting resources to offer the vaccination on buses. We've been looking at what different places have used, whether they can go and vaccinate in different locations. So not under this, we've previously done the work and had the really intensive vaccination programme using the mosque, Hightown Community Centre, Luton Irish Forum. So we've helped the CCG in using more community-based outreach work. Did you want to add anything, Nikki?
Yes, I think, and I again really welcome that, because we have to respond, as we all know, to the needs of the communities we're serving. So without a shadow of a doubt, we need to have far more targeted outreach to the community, which is what we're starting this weekend with the surge planning, to really to home in and focus on the communities that we know haven't come forward yet. So for me, it is absolutely being a single team serving the population of Luton, and I think more and more in that we don't see ourselves as anything, as a separate standalone team. And quite frankly, it is working with the local wards and understanding the local people and just having a really, really personalised targeted services. That's how I see it. And we just need to be agile and adaptive as things come up. So yeah.
So one of the things the CCG has the benefit of when it works with us is that we know Luton, you all know Luton very well, and we can feed in that input of, we might think something's a really great idea and we kind of talk about it and we say, well, actually that might not work there, or this might work better. If you think of the innovation that we've done, we were one of the first areas to offer a vaccination bus outreach at a supermarket. So it seems a long time ago, but when we were working on that back in March, I think we were one of the first areas. I keep looking at Licky on the screen as though she can see that I'm talking to her in that way. So, but that's a really useful, being innovative. And we think that having a post supporting the CCG will allow us to do some of that innovation more quickly.
Okay, thank you. Behavioural insights work. Is there any results coming out of that? Yes.
It's a bit early yet. So we know that the Vaxi Taxi is helping some people who wouldn't have gone to be vaccinated, and we know that the reassurers are helping because they're out and about. One of the things that we want to show is that you'll see that there's the line on evaluation. So I think when we've got the evaluation, we'll be able to tell you whether it's effective or not. It's still too early on some of those, but yeah, we'll be evaluating it.
Sure. Okay. The COVID marshals. What will happen to them after the end of September? Is it just they'll be finishing, or is there any intention for them to? Their contracts will finish. Right. So. Okay. Unless we suddenly find that we have a requirement for them, but right. At the moment, that ends in September. Okay, thank you. Councillor Moore.
I presumed it was under enforcement, but I was just wondering where the actual cost of running all the vaccination centres comes into this. Is that part of the enforcement?
No, the vaccination centres are all funded directly by the government to the CCG. Okay. So we are supporting getting the messaging out around vaccination and also encouraging and supporting community locations. But the vaccination programme is the CCG's responsibility. But we're working really strongly together on that. That will cost many, many millions and would take all of my comp funding very, very quickly if I had to start funding that.
Yeah.
Is that fair, Nikki?
Yeah, and if I just add in there, because you're absolutely, it's a health, a health accountability, and that is where, and quite rightly, in behalf of the taxpayers, we're being asked to really be clear about making it the most cost effective. Hence the reason why we are working with community pharmacists that have worked really, really well. So that's utilising the current, their current, premises. And making it very agile again, so it's walk in as well as bookable appointments. But again, going back to what Laura, Elizabeth and I said earlier, it's we've got to make it attractive and amenable to the people we serve. So we know through all the learning that we've taken, we've got to have an agile model. So rather than spending a lot of money on additional sites as we had in the phase 1 and 2. It is really, using that bus where it can travel, and again sending, teams, flexible teams out to communities, and utilising the publicly funded estates, which is what has been fabulous, working with the local authority. And Laura mentioned the mosque. It's about using your community assets in the most effective way as well. So we'll carry on that vein.
Okay.
So one of the things that we know nationally is that COVID has had a disproportionate impact on certain groups. So we want to use the comp funding to really understand that. So you will have heard Sally and Lucy talk about the Talk, Listen, Change research, which we commissioned from the University of Bedfordshire. We think that we should be using comp funding to really support community projects to tackle inequalities, and that there's a really strong steering group which the portfolio holder for public health chairs that can allocate funding for projects. So they haven't got their projects going yet, but we think that that's really, really important, and that there's a need for a health inequalities post to really drive that agenda. So that's a really important piece of work that will help set the new agenda for us moving forward into next year. So that may be one that you want to have some more detail when the projects are coming through on that one. But it is fundamentally funding to go to community groups who are working to tackle health inequalities created by COVID. And then we've got a whole series of additional commissioned activity here, really focusing on some of the areas of concern that we talked to you about last time, and other people have highlighted to us. So concerns that there hasn't been enough treatment for drug and alcohol, that we need to provide additional support for low and moderate level mental health issues. We need to be able to provide support to families and children with mental health issues, and provide additional advice and guidance. So in this package, we've got our response to some of the things that we know have been impacted by COVID. The one that you can also see there, we know that, or we think that smoking may have increased over COVID, and therefore we want to really get on top of some of our work around illicit tobacco again. And you remember we've run campaigns in with the Trading Standards Environmental Health to really target illicit tobacco. So we think that's a really important public health area of work.
I'm a bit surprised obesity isn't on there.
I know, I'm only on the first page.
All right, yeah.
Elizabeth, is there anything I've missed on those core areas?
No, not so far. No, you've looked in the first half, but I think it was absolutely the young people's mental health areas that are highlighted there, that we know there's been a massive impact on young people's mental health around lockdown, and then obviously the mental health for the wider population as well.
So you'll see that this is that theme of supporting young people, and also one of the things that we think is an important issue is some groups know where to go and get support and will self-refer. We need to understand why other groups don't do that. So we're suggesting some research on there, which is that focused work into why specified ethnic groups are underrepresented in self-referrals to mental health services. We want to do some more work around additional support packages for ELF, who are our mental health provider. And then the next one is that encouraging people to be more active. So activities in parks, walking, outdoor gyms, etc. So the vast majority of that money would be spent on things in parks, but because that's quite a lot of money to get out of the door, we will need an extra resource in parks just to make sure that that works okay. So we're doing some investment there. Any questions on that bit? And then we also know that when we return to normal, we're seeing some more mental health packages required, but we're also going to see more safeguarding referrals as people start visiting in care homes, and also we will get more cases coming through to us. So we want to put some more resources into our front door for social workers to help on some of those assessments around safeguarding. That's really important. And I think the other thing that we are concerned about at the moment is that the care home market and the home care market are fragile. So you will have seen in the national press, I think the Isle of Wight Council saying that they weren't able to deal with some care needs recently. And you will have also seen there have been real changes in the care market. Will people think that going into a care home is the right thing now? So we need to do some work on managing that market. So they're all of the packages and areas of work that we think are important from our commission services. So this is all allocating some of this resource to our own services or to services that we currently commission. It's an easy way for us to do it, but it's focused on the areas that I think we talked about here. So mental health, the whole issue about safeguarding, support for children and young people, and also more work on getting people active.
Just wondering why that safeguarding, the amount for that's in brackets, because normally when I see brackets and an amount like that, that works in the other direction. I'm sure that's not the intention here.
So that's my shorthand for my check of, so that's the 150,000 is for the additional social workers and front door, and the number is in brackets is just my check that adds up to a total number that then reconciles at the end. Yeah. No, that's my sense to make sure that I wasn't, because I had to check back on all of these numbers that added up. So we talked to you last, sorry, did you have?
Yes, sorry, Laura. Just actually, it's more of a comment really. It's just that I think the emphasis on the recovery and the commission services is quite important. I think so. We've been pretty much derailed in the pandemic from our usual processes and ways of working, and getting back on track is very important, especially if thinking about the longer term. If we wanting to our long-term ambitions for 2040 and those sorts of areas. Yeah, I think that. Yeah, that's I like the emphasis on the long-term recovery.
Thanks, that's helpful. So again, we talked to you last time round about the proposal for a community fund to invest in community organisations to support recovery and response. We've done a bit more thinking about this, and there's still some more work to do, but we've begun to think about target groups that this would be helpful to be targeted at. So you might have some views on this. So we think that this fund should help on mental health, tackling social isolation, vulnerable people and those that have been made more vulnerable by COVID-19, BAME communities who've been disproportionately impacted, and the impact on women. So they are some target groups that we think through our evidence and analysis have been impacted by COVID, but there can be a community response, and we want to support some of that. So we talked to you before about having a community fund and linking that into Bedfordshire and Luton Community Foundation for distribution of those funds. We're still working on that. We still think it's a very important thing to do to help the community recover, and also some of the groups that have been very active during COVID and their response. we've left a line in there for enduring transmission, which is this where I've said that the numbers go down, but we kept to a kind of plateau point. So we think that there's more work that we can do around that. We're leaving that budget line in because we are hoping that we'll be able to do some work with one of the government specialist groups around this area. We were hoping that we would have heard of what that might look like by the time I came to this meeting, but we haven't got any more ideas of what that is at the moment. I talked at the beginning how we need to keep some contingency in case things happen later on in the year. We've reduced the contingency down to 600,000, which we think is okay. And that leaves us with an currently unallocated amount of 302,000. So should we talk about the programme as I've identified it and set it out to you? Are you happy with that in terms of the priorities we've put, the flexibility we've got in there, and then we can talk about the ideas for the use of the unallocated funding? Is there anything that you think, oh well, does that fit in somewhere, or is there anything else that from our programme that we've identified already, or would you like to focus on what's the opportunity here of the unallocated money? So are you broadly okay with the programme as I've set it out? Okay, so one of the challenges for me of supporting the management of comp is it's uncertain at the moment. So if we get funding for LFT, we'll have a lot more money to spend, but we still need to spend it by the 31st of March. I've got the uncertainty about what happens about local authority contact tracing, whether that will be needed. And I need the contingency to make sure we can deal with anything that might happen in the intervening time. So what we'd like to do is have some ideas for the current unallocated funding of 300,000, but begin to identify a pipeline of things that we might be able to bring in if some more money becomes available. And that we've got a process for that, which I'll go on to. So these are some ideas at the moment, and you may have some more ideas coming through. Should we, of the unallocated 300,000, actually add in some funding for each ward to go into the participatory budgeting process? The next round of participatory budgeting is coming up in September, October. So you could have local projects coming through your ward engagement into that programme. So that's one idea. I hope you've seen that this is a really complicated budget for us to manage with lots of different lines in it and all of the reporting. We're currently doing that within existing resources, and we'd like to put a project manager in to make life a little bit easier. Another idea that we've had is, should we use some of this money to invest in the disabled facilities grant? So you'll know that that's a grant that we give to people to make their house fit for them to live in longer term. So that might help for people impacted by COVID. We could invest some upfront money to help with the Fairness Task Force. The Fairness Task Force is a piece of work that's being led in the Chief Exec's department. That, if the Fairness Task Force gets up and running, could then lead into a multi-million-pound bid to the Community Lottery Fund. So that's kind of upfront investment to get some good projects going to access Community Lottery Fund. We've already allocated £250,000 to parks and open spaces, but if you felt that was a priority, you could put a bit more money into that. In the kind of public health world, Professor Marmot, I think he is, does a lot about the marmot of the wider determinants of health and how, you know, having a job, having a good quality house, having a good quality of life helps on public health outcomes. There is currently a marmot review happened in Manchester, and there is a kind of marmot cities approach we've been talking to Professor Marmot and his team at UCL, and potentially there's an idea about us being a Marmot town. So a town that is really committed to those wider determinants of health. If we want to do some work with the Marmot team at UCL and the wider links, there's a cost of that of around 50,000. That could also be something that's quite helpful to do and sets us moving and going forward. We could put some more investment into resilience into the home care and domiciliary care market. So they're ideas that we think would be good to have in the pipeline. What I think is probably helpful is the view about the participatory budget one in particular. And then if you've got any other ideas that we can build into our pipeline, and what we're going to suggest then is if we can get a list of ideas of pipeline projects, they can then executive can give delegated authority for my post in consultation with the portfolio holder and the Section 151 officer to bring those pipeline of projects forward. So the thing that's important is to make sure that we are spending the money, and we're spending the money in line with the comp guidance at the beginning. So if you've got other things that you'd want us to look at, there's an opportunity to feed in as we develop that program further. So it would be helpful to have your views on whether you think putting money into participatory budgeting in the wards is a good thing to do.
Can you talk a little bit about long COVID?
I don't. I think if you've got some questions about long COVID, I would suggest again that we're going back to Sally and saying in her next report on COVID to you, can you give an update on some of those issues, unless Nikki has something she can add in. But I think there'll be good topics for you to ask a bit more detail from Sally at her next director's report, if that's okay.
Yeah, I just wonder whether there's any of these funds.
I could hear you, Laura, but I couldn't hear your other colleague.
So the question, Nikki, was whether how much information do we have about people impacted by long COVID, and actually whether we should be directing some of this funding to support them.
So we have a funding source specific for that. So I think it's important, again, what you said earlier, is that health would be expected to fund that. So I wouldn't be using your funding on that for this. That makes sense.
So Nikki, I also suggested that when Sally brings her next Director of Public Health report on COVID, that we do a little bit of an update on long COVID and what's happening, because we've got specific clinics and activity, haven't we?
Yeah, absolutely. That. And we can update Sally so she can complete that. Yeah, no problem.
But the long COVID issue, that might be covered by some of these items in the community services, like, for example, mental health, or if BAME communities are disproportionately affected by long COVID.
I think we'll have some research that will support that, but you're right, you've got some pots of money there that can also help to support. So you've got the community fund or the health inequalities Talk, Listen, Change pot. So there is some resources that can go in, not for the health impact, but maybe for some of the community support around that. So we can look at that.
So I think it's obviously a little bit difficult for us to think of ideas this evening. Would it be a good idea if people got back to you with?
Yeah, that's fine. So if you've got some ideas that you think, or you'd like to know whether they fit in with the pots, just send an email in and we can follow up on that.
I guess that applies to all council members, not just this group. Does it?
It could be a question that we ask on your behalf again, is what some of the work that we're doing. My focus at the moment is just to get the agreement on what we're going to take through to executive, but actually it's a good idea to have a call for ideas. I'm happy with that.
Yeah, it's just the first item, the participatory budgeting. If you're talking about allocations per ward, then you would want all the members, all councillors involved in that.
They would be involved in the discussions around the money when it's allocated. It would be executive deciding that that's a good thing to do. So it would be helpful to have your views on that.
All right. Okay. Yes. Yeah. Okay.
It seemed to be a good idea to feed it into an existing programme and to allow some focus on ward issues, ward area activity.
Yeah. Yeah. So we talked about the next steps, having this approved by the executive. So when this goes to the executive, there will be approving what the figures that are here in this in this document. And is there a potential for? We've been talking about getting our ideas and further projects for the budget. So this could be updated before that executive meeting?
It could be updated, or we go with what is here and put a note in that these pipeline of projects will be developed in consultation with the portfolio holder.
Okay, so which would?
I think probably to give members time to put in additional projects, it will probably be that's developed in, we'll put in a line that there's a pipeline to be developed and it's signed off with the portfolio holder. That means as members, you've got a bit more than, I think if we've got to finalise the report to executive, I think I've only got about a week left. So it would give us a bit more time if we've got that the pipeline would be delegated to the portfolio holder.
Yeah, that makes sense to me. Yeah. Okay, is that finished? Yeah, thank you very much. Oh, sorry, yes.
Laura, I don't know if you're able to help. I mean, it's immensely important that the groups within Luton that aren't getting vaccinated, it's immensely important that they're encouraged to do so. But I'm just wondering, and I don't know whether you can assist because I don't think the government's clear at the moment. Have you got any idea about these boosters, the third vaccine, if you like, about whether it's going to be for all of the over 50s or just certain groups? Is there any update that you might have at all?
So I think any update on that will come from the CCG. So I'm going to hand over to Nikki to deal with that.
Yes, so at the moment, the decision about the boosters is still with this committee called the Joint Committee of Vax and IMS. There has been, so the Clinical Commissioning Group have been working on plans with the local authorities. Initially, we were told it would be possibly the 6th of September. We were told last week it's more likely to be the 20th of September, and that's all pending, again, this Joint Committee of Vax and IMS. At the moment, we believe it will be 50 and over. And then in addition to those, that may be some other clinically, what we call clinically extremely vulnerable, that may be 18 and above. So we've had, I mean, these are from individuals who are participating in that Joint Committee of Vax and IMS. That's the sort of updates, but that's all just assuming, and absolutely until we're told in concrete we won't know, but it's of course our duty to prepare. So that's where we are. So if our expectation is there will be a booster programme, but as I say, until we are informed, we don't know. Elizabeth, you may from health networks, you may hear it. So I think that's much the same what you've heard.
Yeah, I don't hear. Yeah, no, I think I don't know your source of information, but it sometimes tends to be BBC before it's kind of official channels. So yeah, no, I don't have any additional kind of lines of communication.
Thank you very much. Thanks.
Yeah. Okay. So the recommendation is to approve and review. Sorry, review and approve. Is that correct? Yeah. So do we support the recommendations as laid out in? Yeah. Okay. Thank you.
Thanks, Nikki and Elizabeth.
Yes, thank you.
Thank you.